also had struggled with endo since she was young, was an athlete like I was, and had multiple surgeries. And she encouraged me to look into both Nancy's Nook and I Care Better. It was on the I Care Better website that I found you.
Oh,
As
yay.
Yay!
I
Yeah.
actually didn't know that.
I didn't tell you, I guess.
Nope. But that's cool.
And I think that I also found you on Nancy's Nook at the same time.
Oh,
So it was right, I think, right when you had been welcomed into, one of the Nook's providers.
yeah,
You've been
yeah.
on a better provider list for a while.
Cool.
I reached out to you, and I had also at the same time reached out to a couple of different physicians, one in the Stanford area, another one in the Los Angeles area. And I had gone so far as to make an appointment with another in Los Angeles, and I had seen someone in Laguna Beach in between where all of those appointments were happening. I was exploring various different physicians. My friend that has endo, that lives in mid-country, had a really good experience with her physician, who was also cross-listed on both I Care Better and Nook. And so I considered flying there to St. Louis and recovering in her apartment with Ron, or somewhere else there. Actually see you first before I made a decision about which doctor I was going to explore using. I'm really glad that I did, because meeting you has changed the trajectory of my life, I think.
Oh.
For many different reasons, but also because you're such a caring and incredibly skilled provider, and just a wonderful person overall.
Oh, that's so sweet. Thank you.
You're welcome. And
I'm
I
so
know
bad with
that
compliments.
I was just about to say, I know that taking compliments can be hard, but I really mean this, because I've come across other providers who don't have great bedside manner, who might have the skill, but it doesn't really matter because you can't hear what they're saying, because they're just not a good fit for you personality wise. I think
Yeah.
that you're able to use your vast skill set, as well as your amazing bedside manner and your ability to listen,
Mm.
really is huge.
It's so important for these conditions, seeing so many complex conditions, endo in particular, because of the struggle for so many years. Listening also gives really key information. I also want to put this out for any providers that are listening to this. As a provider, sometimes these complex conditions can feel really difficult and very overwhelming. You sometimes may feel like, I don't have the skill or the knowledge. But one thing I would suggest for any provider out there wanting to get into this field, feel passionate, listening can give you some really key information. You can learn the other things as you go, but if you listen, you will hit key factors in these people's stories that can give you the information that you need to then seek out the right information. I agree with you 100%. The listening is so important. Yeah.
Yeah. It really fosters a sense of someone cares, can help me.
Mm-hmm.
If someone isn't listening to me, I automatically go to, okay, where is the gaslighting going to start?
Mm-hmm.
When is the gaslighting going to start?
Yeah.
What is this going to bring up for me, or what is this going to happen to me? Because this has happened to me my entire life, where I have not been listened to. I've been dismissed. I've been gaslit. And I've gotten to the point where I'm pretty good about gaslighting myself without anyone even saying anything.
Yeah.
So lots of trauma related to medical care for me. And I know that I'm not the only one.
Mm-hmm.
And it's something that I've been actively working through.
Yeah. And listening isn't always an easy thing that comes naturally because I talk a lot.
Me too.
So
You
I'm
do. You
glad
really.
that I'm glad. I'm glad. I do actually have to actively try to do that because I do talk a lot.
Well, you're doing a really good job right now too, because have been just talking, talking, talking.
Well, yeah, this is your story. Something that you had said during a visit a couple of months ago after we put out the podcast, and I think there was 3 or 4 episodes, which included some patient stories that were also providers. You had said, I had a realization. The reason I've asked you multiple times, do I still need to be coming? I did not perceive that you were irritated about coming or didn't feel like it was helping.
Not at
But
all.
your insight as to why you felt that way that you shared with me was really fascinating. Can you share kind of what you said and where that came from?
Yeah. So, therapy, and shout out to my amazing therapist who has helped me significantly. She knows who she is. It was interesting to me because I was seeing this pattern, and it was not just with you. It was also with Dr. Spring Robinson, with other physicians, but maybe a little bit more with you because I felt like I should be better, not like completely back to or at what someone would call normal. Maybe not having to go to pelvic floor therapy every single week. I saw myself having this pattern where I would ask you about once a month, do I still need to be coming every week? And you said yes. And I said, okay. And I came back every week. And then the next month, the same thing would happen. And after listening to those stories and talking to my therapist and doing some just introspection, I realized that I am so keyed up with providers not being able to help me getting to a certain point where I am better enough that they think that I can handle it on my own, or there's nothing else that they can do for me, that I either stop going back because I feel that they're frustrated
Mm-hmm.
with their with the lack of progress that I am making,
Mm-hmm.
almost like I'm not trying hard enough, or there's something else going on, or I'm going to be dismissed as a patient. Which, to be fair, think I think it's only happened once in my life, but that was because I was told that the doctor was retiring, and I later learned that they, in fact, did not retire. So I'm not sure what happened with that, but it makes me really uncomfortable.
Yeah.
So part of the reason why I was asking you that on a pretty consistent basis was because I didn't want to be dismissed as a patient. And I felt better enough that I was like, okay, this is the point where people usually get kind of frustrated and don't know what to do with me.
Mm-hmm.
So I'm just going to head it off or make sure that I do need to keep coming back and that you share my opinion that I need to keep coming back.
Yes.
And what do you remember what you said to me?
I don't remember the exact words I said, but I think I remember saying along the lines of that this was sort of a change in status. You had just had surgery. There was a lot going on with your care just from post operatively, given all the musculoskeletal stuff you have, the potential for EDS, and just that I think that there was this push for you to be better on a specific timeline.
Yeah, because I'm not very patient. So I don't do well with things that are a process. Like even things that are a process, I try to force. I want to tell you what you said to me because it affected me so deeply that like I had to pause, and then it was the end of our session. But I think you stopped what you were doing and you looked at me, and I stopped what I was doing because you were stopping and looking at me, and you said, I don't think that I've ever met someone who as motivated to get better and tries so hard to get better as you do.
I very clearly remember saying that, I think on 2 occasions, and I wasn't relating it to that particular visit, but yes, it's so true.
And I got a little teary again as I said it, because that's how I feel. But at the same time, there's this other part of me that's like, but maybe you're just making this all up, or it's all in your head. And even though there's physical proof that that's not the case, my brain is trying to find a way to be okay with being dismissed.
Yeah, that almost like a protective mechanism to not be hurt,
Yeah.
like a guard. But yes, for everybody listening, so before surgery, I just want to share a little bit about all the things that you were doing. Number one, you showed up to every appointment. Maybe there was a cancellation, but there was a very legitimate reason. Always reschedule, always came on time and prepared. I think the issue more so with you was kind of roping you back to being like, rest is important more than like doing, and you weren't overdoing it. So don't get me wrong, because that can be an issue too. But I think that there's this disconnect between mentally where you're at and physically where you're at. But it was, what can I do next? You were very active and engaged in your own care and participation, not just waiting for instructions, always asking more questions, from all of the self foam rolling, strengthening things that were appropriate, going to various providers like, hey, we recommend this. Why don't we try this? Very engaged in the process. You definitely stood out to me in particular because I was always amazed at how much you had going on that was impacting your immune system, and you still kind of fought through it. And you would come up and say, this week I wasn't able to do anything. I had this, this, and this. And it made sense